Did Betty Ann drop off?
I think so.
Okay, I'm sure she'll join here in a second. I'll text her. That was bad timing. Representative Blanksma, I wonder if maybe you could start the meeting until Betty Ann rejoins, if that's okay with you.
Sure, I can do that. We'll go ahead and call the meeting to order and then move on to roll call. So let's start with Boise County.
Commissioner Sturm here.
Valley County.
Commissioner Hasbrook, present.
Ada County.
Jane Young, present.
Ted Epperly, present.
Commissioner Lachiondo, present.
And this is Representative Megan Blanksma. And Betty Ann, have you made it back on the line yet? Okay. Then let's move on to item number 3, changes to the agenda. Russ, did you have any changes?
Madam Chair, no changes to the agenda today.
Okay. Let's move on to item number 4, new business. Do we have any motions on the meetings from the minutes from August 4th?
Madam Chair, this is Al.
Commissioner Hasbrook?
I make a motion we approve those minutes.
I second it. This is Jane Young.
Okay, so we have a motion on the floor to approve the minutes by Commissioner Hasbrook, seconded by Jane Young. Let's go ahead and take a voice vote, if you don't mind. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
Okay, and this is Representative Blanksma, aye, and we'll check again. Betty Ann, Madam Chairman, are you on the line? Okay, I guess we'll move on. So that that item passes. The minutes are approved for the August 4th board meeting. We can move on to item number 2 under new business, discussion on criteria for determining quarantine and restriction orders for Ada County. And then Kim Link, are you on the line for us?
Yes, I am, Representative Blanksma.
Perfect, good to hear from you. I'll just let you take it away.
Okay, perfect. Dustin, can you please pull up?
This is Betty Ann. I'm back on. So.
Okay, Betty Ann, this is Representative Blanksma. So we went through and we're on down to new business item number 2.
Okay, fantastic. Thank you.
Thank you.
Okay, so this is Kimberly Link. I manage our communicable disease control program here at Central District Health, and I know that you on the board are familiar with the work that we're doing with COVID, and what I'm here to talk about today is gating criteria for determining quarantine restriction and orders relating to Ada County. And Dustin, if you could you pull up the other documents? that provides the criteria. While he's working on getting this pulled over, so what we're looking for is we've created a document, and this was done back in early June when we originally worked on it, to provide a framework for the decision-making that needed to go on regarding providing additional restrictions in order to get our case counts coming down for COVID. So the document itself is based on different criteria that we are looking at, and we seem to be having a little bit of an issue with getting that document pulled up. Dustin, are you able to pull up the document that's called Criteria for Determining Quarantine and Restriction Orders for Ada County? So while he's working with that, as background, we developed a set of criteria to use to set the stage for the decisions that were happening. And the criteria focus on, here we go. So we have 2 disease criteria that we're looking at having to do with reported confirmed and probable cases among residents of Health District 4, or in this case, Ada County. Disease criteria 2 being no publicly declared illness clusters. And then a 3rd criteria looking at our healthcare sector. And this criteria was recently updated. We were looking at emergency department visits. However, that was determined to not be as good of an indicator of our healthcare capacity and what was going on in the healthcare sector. So the 3rd criteria for hospitals has been updated to look specifically at hospital admissions among residents of Health District 4. And this information is being reviewed. Information is posted twice weekly to our public dashboard off of our CDH website. And Dustin, if you could move to the 2nd page of this document, please. So in terms of
Madam Chairman,
with the document.
Madam Chairman.
Yes,
Chairman?
Megan, go ahead. Yes.
May I ask a quick question of Kim, please?
Yes, go ahead, Megan.
Sorry to interrupt. I just wanted to catch before we went on to page 2. And if we're looking at disease criteria number 2, where it's no publicly declared illness clusters, can you tell me where that's to be found on the website?
So those illness clusters, they may be declared in a few different ways. When we originally had the cluster that was related to the downtown bars and restaurants, that was something that was declared via press release. Currently, clusters that we are keeping an eye on include illnesses that are going out at the Department of Corrections facilities in CUNA, and that information, those updates are actually being provided by the Director of Department of Corrections. And the other one that we're keeping an eye on right now is through the Ada County Jail. So if they are clusters that we are solely monitoring, typically those would be information that we would put out via press release, but in these other cases, they are being, the information is being put out by other agencies. Does that answer your question?
Yes, it does. Thank you very much.
Okay. So as we look at this framework, and again, it's a broad framework to help aid in decision-making on whether or not additional restrictions are warranted based on level of disease transmission. And what you'll see is we have 3 sections in the modifications area having to do with number of cases that are reported. So if we have cases that are greater than 25 per day on average or 175 per week, if those reported cases are fewer than 25 per day on average or fewer than 175 per week. And then down at the bottom, we have an additional contingency, which talks about if our reported cases are exceeding 100 per day on more than 3 consecutive days. And where we're sitting right now, we've been above that threshold since about the middle of June. And just starting with that, since that's where we are currently, when we are in that level, recommendation is to look at providing additional restrictive quarantine and other restrictive order measures in order to get those case counts below 100 per day consistently.
Madam Chair.
Yes, I'm not sure who spoke up. But...
Sorry, this is Commissioner Lachiondo. Kim, can I pause you for a quick question?
Sure.
So one of the challenges I know we've had is that finding this translation from case count to hospitalization to ICU, et cetera, can be tough, especially as it starts affecting different populations. And I guess what I'm thinking about is that back when we had the bar cluster outbreak, many of those cases were in younger people, so we weren't necessarily seeing that translation as much to hospitalizations, but as it's moved into the rest of the community, we have seen more. So can you talk about how we will think about that number, that 100 number, as it's in different populations?
Sure, I'm happy to talk about that. As we look at it, the number 100 is based on really our best estimates and working with our healthcare partners to use the science of understanding how many people on average are hospitalized due to COVID, and recognizing that the healthcare capacity and the inpatient capacity to be able to care for everybody adequately in the hospital setting. And I think the downtown cluster that we saw was a great example of where we saw a rapid increase in the number of cases that were being reported. And very early on in that outbreak, they were, most of the people were within that 18 to 29-year-old age group. And as we saw that the illness then moved from that more defined cluster out into the community, we saw that that age group did change. And that's at the point when we saw additional hospitalizations occurring as a result. And I think that's a good indicator that within our community, if we're seeing consistently more than 100 cases a day, it's very unlikely that that would be limited to our younger population. So we'll say under 30 or under 40 years old. So those people who are less likely to be hospitalized. And again, we're working with the best information that we have available to us. I think that as we look at the 100 per day metric, we may find that over time our community may be able to support higher case counts before we say that we automatically have to be more restrictive. But based on what we've found with working with our healthcare partners, talking with the hospitals, is at this point that 100 per day seems to be a good indicator of where our hospital partners are becoming concerned as far as the number of admissions that are happening. Does that address your question? Okay, perfect. So when we are looking at, to move to the very top of this page, so if we are in a position where our number of cases are greater than or equal to 25 per day on average, so if we're saying we are seeing consistently 25 to 100 cases per day, we have three directions that we may go in terms of looking at the modifications to orders. So loosening orders or lessening orders would be recommended to occur when we see that hospital admissions are going down and our case counts are going down, and then also that disease criterion 2 is met. So we don't have any outbreaks that we're monitoring that we feel could significantly impact our community. We would look to stay in place in terms of maintaining current quarantine and restriction orders if either our hospital criteria or that disease report criteria are showing an upward trend, but that not dramatically increased. So if we see between the 2 week period of time that increase from week 1 to week 2 is 50% or lower, then that would be an indicator to stay with what we have currently. And then also that we aren't monitoring or we don't have any outbreaks that we have concern with. Where we would look at recommending potentially more restrictive measures is if we are seeing a more steep upward trend. So week 1 numbers in terms of hospital admissions or the disease reports that are coming in, if we're seeing a greater than 50% increase between those first and second weeks of the 2-week period. So we would move in one of 3 directions potentially when we have 25 to 100 cases a day being reported. If we find ourselves back in the position of having fewer than 25 cases per day being reported, or fewer than 175 per week, we would, our community would be in a very good position. And so we would not look at, not recommend more restrictive measures, but we would look at potentially lessening those current restriction measures that would be in place if the hospital criteria and the disease criteria, so the reported number of cases, were both showing a downward trend, or if there was an upward trend, but it was less than a 50% jump between those 2 weeks, and that we didn't have outbreaks that were of concern. If we're at fewer than 25 cases per day that are being reported, and we are seeing an upward trend that's greater than 50%, then that would be an indicator that we should probably stay the course of where we are. So we know as a community that we can continue to handle additional cases within the community, knowing that our hospitals would be in a position to care for those people. But we would want to continue to stay the course as far as what was being currently recommended. And again, as we look at additional considerations to this, these are being measured on a 2-week time period, and we may see situations where waiting that 2 weeks is not the most prudent approach. So again, if we're seeing greater than 100 cases on 3 consecutive days, that would be an indicator that immediate action would be warranted. Or if we're seeing that our hospitals are implementing crisis standards of care, or if those hospitals are saying that there's imminent concern about increases in cases in the community, those would also be indicators of additional action, potentially being warranted in additional discussion. So that's our framework. Again, it is broad-based. It's based on the number of cases being reported. And again, it's intended to be a guideline for more in-depth discussion regarding potential new restrictions being put in place, or the lessening or the loosening of restrictions as well. And I also have a couple of slides that look at where we're sitting currently in terms of the healthcare criteria, and then also our reported cases criteria. And Dustin, if you could switch over to that other slide deck.
While you're doing that, Madam Chairman, may I ask a couple questions, please? This is Representative Blanksma.
Go ahead.
Don't get me wrong, I'm very excited to see this, Kim. Thank you for providing some criteria as to how the decision-making's been working or will be looked at going forward. I have a couple of questions just for clarity, if you don't mind.
Sure.
When I look at this, it says, note that the document only applies to Ada County, but my understanding is what you're doing is you're taking numbers from all of the Health District 4, not just Ada County. Is that correct?
In terms of hospitalizations, and I guess to back this up, so Dustin, can you switch back one slide or back to the beginning of this slide deck? I think as we walk through or as the data is up, that might help to clarify. So right now, the healthcare criteria is a new criteria to this framework. We had originally been looking at syndromic surveillance data, which that was looking across the entirety of the health district. However, in terms of looking at the reported cases criteria, that's actually being looked at specifically for Ada County. So we have the ability, because that data is coming from our cases that are reported to us and our investigations, we're able to easily drill down to determine county of residence. And as we look at county of residence, that's being published on our public dashboard on the twice weekly Monday, Thursday update.
Oh, Madam Chairman, follow-up?
Yes, Megan, go ahead.
Actually, Kim, no, because that's kind of my concern, because if I look at and read this, what words are printed on the page, Disease criterion 1, reported and confirmed probable COVID-19 cases among residents of Health District 4, which means that reported or confirmed and probable cases in Elmore County, Boise County, and Valley County could potentially determine what happens in Ada County. And so I just want to be clear as to what the document says. And additionally, that translates down to page 2 as well, where you're saying reported cases exceed 100 per day on 3 consecutive days among residents of Health District 4. And again, this isn't hospitalizations. These are reported cases or confirmed and probable, which are then translated into reported cases, is my understanding. And so I just want to be clear that instead of just using Ada County numbers, even though that's what the use of document says only Ada County, it appears that you're using numbers from the entire district. Is that an accurate assessment of the document?
That is an accurate assessment of the document, and I believe that was an oversight in the original document that we had posted back from June, looked at the health district as a whole. And as I mentioned, we did a recent update on the document, and it looks like those are edits that did not get caught appropriately. So those should say Ada County.
Okay, thank you for that clarification. Appreciate it.
You're welcome. So as we look at the data that we're working with, again, the hospital criteria is new to this framework, and it is something that we are still working with our healthcare partners to be able to drill down to get the specific information that we are needing. So right now, our hospitals in Health District 4 are routinely providing information regarding number of hospitalizations due to COVID or people with COVID within their hospital. They are not, however, presenting that information based on a county of residence or jurisdiction. So the data that I have here when we're looking on the left-hand side of the screen is hospitals within our health district. These are the number of patients by the day. So again, these are pulled on Monday and Thursday. The number of patients in the ICU. So this is total ICU census. We are hoping to work with our healthcare partners to be able to drill down and have that based on county of residence so that we have the opportunity to be making decisions regarding Ada County based on Ada County hospitalizations. And again, on the right-hand side of the screen, we have the number of patients who are hospitalized in Health District 4 hospitals who are not in the ICU. And so as we look at these indicators, what you can see as a whole is that we've seen slight decreases over time. I haven't put a trend line to this at this point in time, but flat to slight decreases in our number of hospitalizations. And again, this is something that we really want to see these numbers come down as an indicator of the health of our community. And Dustin, if you can go to the next page. So as we're looking at confirmed and probable cases, so that disease criteria 1, recognizing that right now we do have the outbreak that's going on out at Department of Corrections, the information regarding number of cases is important to think about in that context. So as we look at Ada County overall, on the left-hand side, the bar graph shows number of cases over the past 4 weeks, just to show a broader trend of what is going on. And you'll see within this 4-week period of time, we've only had 4 days that we've dropped below 100 cases being reported. Typically, that ends up being on Sundays. I think it has more to do with lab reporting, but we are still consistently seeing days with 100 plus cases, and we are still seeing occasional days with 200 or more cases. And on the right-hand side, you'll see that's the same data just for the past 2 weeks. So between the 26th of July and the 8th of August with a trend line added to it, and you'll see that that is still trending upward. Dustin, if you can move to the next one. So again, knowing that the Department of Corrections it's a large outbreak that's going on right now, and that definitely has the potential to impact our community largely just due to the number of staff that work out there. But we also realize that it's a confined population and has a high probability for spread of illness as well. So it does seem fair to look at our data in terms of our number of cases being reported, excluding those IDOC inmates, so that we have a fuller picture of what's going on in the community as a whole, but then also what happens when we take those inmates out. And as you'll see, there are some decreases in our number of cases being reported. However, as we look at our past 2 weeks, we are still seeing a slight upward trend in the number of cases being reported. So as we look at this in relation to that framework, again, we are still looking at having consistently over 100 cases per day being reported, and we're seeing slight increases still within these 2-week trends. And that's really an overview of the data. I'm happy to answer additional questions. I'm happy to turn it over to Russ for any policy type questions that you might have.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, Kim, thank you for this. It's good to know that we've been acting on these pieces of data since mid-June. And I understand that we've added the hospitalization, which I think is a really good substitution, because emergency room usage is actually discouraged by most primary care clinics. They don't want patients unnecessarily going to the emergency room and going more to their clinics. So I think that's the right call on all of that. The question that I had was in regards to other community outbreaks, in particular meatpacking plants or produce plants. Are there any active outbreaks at any of our more confined facilities in terms of meatpacking, vegetable and plant production sites?
To my knowledge, at this point, we don't have any defined clusters. I know that was something that we were working with a few facilities early on in March, April, and May. It's definitely still an area that we're keeping a close eye on, and if cases are identified that are related back to any of those food processing facilities, there's something that we'll want to keep a close tab on, work very closely with the facilities themselves.
Okay, so just as a follow-up, are all of them very proactively using face masking and distancing to the best of their ability, hand washing, et cetera?
I know that for the facilities that we've worked with, we've worked with them to provide those recommendations. To my knowledge, that is something that's going on. Again, it's a recommendation that we definitely put forward. It would be something, as far as getting into the details of the different facilities, I would have to follow up with my staff to find out any specifics.
Thank you.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So this is less of a question and maybe more of a comment for how we think about this going forward. As we've kind of learned and discussed throughout this process and pandemic, these arbitrary lines of our health districts don't necessarily make sense here in the Treasure Valley. And we have people working and living across the border with Canyon County. And my understanding is that both St. Al's and St. Luke's are continuing to transfer patients from Canyon County to Ada County because they're capped in the number of beds they have available to do that work in Canyon County. And similarly, in both Elmore and Valley County, when folks come in and need to be hospitalized for COVID, it's such an intensive process and requires so much PPE and kind of specific staffing that those folks are all being transferred to Ada County. And that makes sense. I mean, those are rural critical access hospitals, but I don't necessarily have something we're doing with this today, although we will talk about Valley County at some point. Today, it's really been Ada County that has taken on the responsibility of additional restrictions. And people are frustrated, obviously, and we get that. But I think we need to sort of look at this holistically, that ultimately these patients are ending up here. And if we start losing capacity in Ada County for folks to be able to access a hospital because they have a stroke or a heart attack or what have you, it's something that we have to be concerned about when everybody's coming in to Boise. So I don't say that because, you know, I'm ready to do something in those counties yet, although we will discuss Valley County, but I just want us to be aware that it is an interrelated system.
Any further questions or discussions for Kim?
Madam Chair, this is Commissioner Hasbrook.
Yes, go ahead.
So Kim, I'm assuming, and you let me know if I'm wrong here, but because we set these specific guidelines, specific levels, as far as what our next actions will be, when the schools open up and some of these kids start going back to school, then's when a lot of these numbers are going to kick in and we're going to realize that things are more serious. Am I feeling correct on that, or is that a wrong assumption?
Commissioner Hasbrook, I think that you're correct in that assumption. And as we have worked to look at the criteria and the levels for schools to make that recommendation of Ada County being at level 3 or in the red, this definitely plays into it. And not only in terms of the number of cases that are being reported, but also on the healthcare capacity side. And I think we heard, you know, very strongly from our healthcare partners that capacity is being stretched and that we are not in a good place, and the potential for having additional cases within the community could, you know, really put a strain on them. And that does need to be taken into account. And I believe that these thresholds do align fairly well with being able to say that when we're consistently under 100 cases per day, that's going to put Ada County in a better position to have kids back in schools, have that in-person learning going on, and recognizing that we'll have that bit of a buffer to allow for an additional level of community transmission without exceeding our healthcare capacity.
So, Madam Chair, I have a follow-up.
Yes, go ahead, El.
So Kim, can you tell me then what this kind of the standard treatment at the hospital is for kids? Do kids end up in the hospital for treatment for COVID, or are they able to stay home and kind of heal up on their own? How much demand are we going to create on that medical system after school's open? Is there a percentage?
Not being a pediatrician, I can speak in generalities. What I can tell you is that we've seen very few hospitalizations among children under the age of 18. I believe I'd looked at what we had published on our public website, and we have had 2 hospitalizations as a result of COVID for those under the age of 18. But again, you know, as we look at the cluster that occurred back in June, we know that what we saw there was when there was this increase within a certain age group, that there was transmission further out into the community as a result. So there is that potential. I believe that, you know, at this point, the science is showing that younger children don't seem to be as infectious. They don't transmit as much as older children. But if we're looking at kids who are 4th, 5th grade and older, they may have the possibility to transmit like an adult would. And the additional component of having kids in school is the number of adult staff that are there between faculty and other staff. And so we need to think about those transmission cycles as well. So if, you know, teachers are potentially working together or as they're interacting with students, that needs to be considered as well.
Thank you.
Yeah, Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, the American Academy of Pediatrics and the Children's Hospital Association just published some data in the last couple of days that in the last 2 weeks of July, this is across the nation, as a whole. There were 97,000 cases of children with COVID-19. And if I remember the data right, because I saw it yesterday, it was about a 2% hospitalization rate. So certainly lower than can happen with older adults, but still can have hospitalization. Sadly, there have been deaths as well, primarily related to this multi-inflammatory syndrome that kids can get. So it still bears us watching carefully. I think the biggest issue is going to be the impact it has on testing. When schools start getting back into session, kids with viruses, runny noses, cough, some fever, parents are going to be, and teachers and principals are going to be in a pretty tough situation. And I know we've proactively indicated data, and they've all worked towards plans, which are good, operational plans for each of those schools about what to do. But how it will play out downstream is that a lot of kids will be brought in then to be tested, which will lead to, again, quite a bit of overwhelming of our testing capacity. And it will push out the results on tests for 4, 7, maybe 10 days. That's going to be the issue there. And so people are in kind of a gray zone for how long do we keep people at home? How long does an adult stay at home? We don't have test results back. So that's the potential impact, I think, that I would add to Elt's question in regards to the impact of this in terms of both on cases, but on the potential for testing capacity.
Madam Chairwoman?
Yes, Megan, go ahead.
Just another question for Kim, if I may. I noticed on what Russ sent for slides that you're using cases by report date rather than the dashboard, which I believe had week of onset and week of report. And I know there's been some issue about getting lump back results because of lab bottlenecks. And I was wondering why you felt like the week of report was a better set of data to set a trend line rather than the cases by week of onset.
That's a great question, and I think it's one where, as we're working with this, we don't have a perfect indicator to work with, unfortunately. And the reason that we're working with that date of report is that's the date where we are aware that this positive result is there. That person who is tested is aware of the positive result, and it provides an opportunity for action on the part of public health. In an ideal setting, I think that using date of onset, it is a more reliable indicator of activity within the community, but it is also plagued by time lags. So we know that a person will, from the time that they become ill, there may be a period of time that passes before they get tested. Some will get tested on the same day. Some will wait a couple of weeks, if not longer, before getting tested, or they may wait until they need to go back to work. And then additionally, the time lag between that test being collected to that being processed, reported out to public health, and us being able to collect that information from the person as far as when they became ill, that often can range anywhere from days to weeks. And so when we're looking at data to make recommendations on, date of report definitely is not perfect. However, I think it's the best and the most timely indicator that we have at this point.
Thank you, Kim. Any more questions for
Madam
Kim?
Chair, this is Elt again. Sorry.
Yes, go ahead.
Kim, what's going around in my mind, and I'm a little bit confused. If we open up the schools and we start getting a lot of kids that are testing, that are coming in sick or positive for it, and we just heard from Ted saying that they have about a 2% hospitalization rate, to me, those numbers are going to maybe skew the data and put us in a higher category than we should be. Am I incorrect in saying that? I know they still should be counted, but they're not as much of a concern as somebody that's old guy like me.
I think that that's a great point for consideration. And that's one of the reasons why these metrics, the criteria and the framework is being provided as a framework to provide that opportunity for discussion, to provide that opportunity to look at the data more closely if you so wish before you're making those policy decisions. And again, it does come down to things like looking at the Ada County data, both including and excluding the Department of Corrections inmates. One thing that I want to make sure is that, as we're putting data out for public consumption and for you to make decisions on, that it's done in a way that is transparent, that we're providing that information so that you have the opportunity to ask those questions and to make educated decisions as far as what policies you want to put in place.
I think, Madam Chair, this is Diana. That really leads back to the question I had about the bar question, because when we saw those numbers start to skyrocket back in June, it wasn't initially translating to the hospitalization rate, but then it did as it moved through the population. And I guess, I have parents asking me, how do I feel if my kids go back to school? And, I'm worried about my kids for all kinds of different things, but I'm not necessarily more worried about coronavirus than any other virus they might get. What I do worry about is, are they not going to be able to hug their grandmother for a year at worry of transmitting to her? So I think, blow that up to a scale of a community here in Ada County of 500,000 people and, 60,000 students in Ada County. And that's what we're talking about.
Kim, this is Betty Ann. I have the state report here that actually came out on the 9th. And, of course, our county, where Megan and I are from, is in the yellow. Is your staff working with those businesses to actively let them know the guidelines they need to be following while they're in this category?
So from the epidemiology program, when we have individuals who are testing positive, if they were in a workplace while infectious, we are working with their employer to make sure that they're aware of that, working with them on contact tracing if there were other employees who may have been exposed, and also in that conversation talking about what their plans look like, where there are opportunities to decrease transmission. And then additionally, here at CDH, we do have liaisons who are active within all 4 counties of our health district who are doing more of that higher level planning and coordination as well.
Okay, thank you. Any other questions for Kim?
Madam Chair, this is Jane Young.
Yes, Jane, go ahead.
I just wanted to tell Kim thank you, because I think this not only gives us a framework, but it takes away the element of surprise so that people can understand it and see kind of what's coming, because they can interpret it for themselves as well. So I really appreciate having the information spelled out like this.
Thank you.
Okay, Kim, this is Betty Ann again. I'm not hearing anybody else speak up. If anybody else has any questions, we'll speak quickly or we're going to move on. So, Kim, thank you so much for the information. I got a goodly amount out of your report. So we will be moving along to item number 3 on our agenda, and this is the Valley County Public Health Orders. This is discussion and potential vote regarding actions to protect the life, health, and safety within the district as a COVID-19 pandemic, to include public health orders for Valley County, specifically mandating face coverings in public places. Russ, do you want to go first, or Elt?
Madam Chair, we reaffirmed the decision yesterday in the commissioner meeting. Sunday morning at 10, I met with a lot of the restaurant owners, and we had a really great discussion. I think one of the things I've noticed is people aren't getting the correlation between the pandemic and the overloading of our medical system. They don't quite understand that if we lose all of our medical providers, there's no place for them to go with a broken arm or a heart attack. And I think that finally is starting to click with people. I wish we could somehow reaffirm that education more with folks, because I saw a lot of light bulbs go off when we started talking about that. Monday when we came in for commissioners, we had some protesters outside the courthouse. I spent about 20-25 minutes with trying to explain to them that we're not trying to take your rights away, your liberty away. We're just trying to slow this thing down to where our medical system can handle the demand. And I saw more light bulbs go off there as well. So I think the word is getting out. I've had some really interesting emails, some of them really nice, some of them really extremely not nice, but right now, generally the support, I would have to guess, is probably around 75% of the people that I've talked to said, great, we need to do this. We should have done it a month ago. So we're still moving forward, and we hope that you guys will support us on our request today.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, I was just going to explain the orders that we drafted, and I worked with Commissioner Hasbrook on that as far as the review, and of course, Attorney Mike Kane, who's on the meeting this afternoon. And we drafted the orders for your consideration. We posted them on the website. You all were provided the comments, not only that we received by the end of last week, but also the ones since Friday up until 4 o'clock yesterday. So these orders mirror what we've done in Ada County as far as the face covering requirement. No other part of the order would be included. It's just the face covering requirement, public places to include schools, public, private, charter. And I realize there's not a main college, university, or technical school in Valley County, but there are small branch offices and activities going on in the county for which the orders would apply for those settings as well. So I just wanted to make sure everyone was aware the orders were published. You received public comment on these orders as well as the proposed changes to the existing Ada County orders.
Madam Chairwoman.
Yes, Megan, go ahead.
Is Mike Kane still on the line? I've got a statutory question for him if he is.
I am, yes.
So, Mike, just out of curiosity, and I didn't go look it up. I should have. I didn't do my due diligence. But is there anything in statute that's preventing the Valley County Commissioners from just instituting the mask order regardless of whatever we do here at Central District Health?
Thank you, Madam Chair. Representative Blanksmith, the law is absolutely silent on what counties can or cannot do as to health orders similar to what we've been seeing. I do believe that the county commissioners can probably pass an ordinance that would be part of their police power to protect the public health, but the statutes are silent, completely silent on the issue.
Madam Chair, this is
Thanks,
Al.
Mike.
I'm sorry, Megan, you want to finish your question with Mike before you go ahead?
Yeah, I just had a follow-up comment. I understand that this is what Valley County wants, and I'm super uncomfortable with this unless, and maybe Elt's about to explain to me that their numbers are going up in some sort of severe way. I'm not ignorant of how overwhelming a hospital works. I'm not ignorant of the data. I'm just concerned that although there's a portion of folks that are interested in Valley County and having this in place, that we're not dealing from a strict public health data request. That's my concern.
Madam Chair, this is Al.
Yes, Al, go ahead.
and this is more towards Mike, we talked with our prosecutor and she did find something relevant in the code that says that city mayors can institute mandates, but county commissioners can't do that as far as health is concerned. And so we've been kind of operating on that premises that we didn't have the authority to do that. Another office that can do that is, of course, the governor. But our concern that we have is we're kind of the playground for the two hottest spots in the state right now that want to come up here and play, and that's great. We want them to come up and play, and so far we've been really fortunate that our caseload hasn't really gotten bad yet. But I would rather do something ahead of time than wait till after the crash has happened. So we've all three think that this is the smart thing to do, and some of the business owners want us to do it. A lot of the businesses are doing it now, mandating masks to enter their business, and some of the restaurants, of course, are still social distancing, and they're doing a very good job with cleaning and masks. And we kind of want to reaffirm what a lot of good folks up here are doing. And to me, it just makes common sense. If we didn't have all these folks coming up here every weekend, it probably wouldn't be too much of an issue. But I believe last weekend it was 98 or 9,200 cars on a Friday night. So we get a lot of folks coming up here on the weekends.
Madam Chairwoman?
Yes, Megan, go ahead.
Elle, if you don't mind, if I could ask a question, do you think it's possible just to go with the recommendation rather than the mandate at all, or do you want to totally jump straight to the mandate? Because I'm just trying to be consistent on why I'm voting for stuff, and I want to see a data set that shows an increased problem. Now, I understand that you want to get ahead of it, but do you think that just recommending masks provides you with what you need?
First of all, we recommended about a month ago, I think, I don't know, I don't remember the date, maybe 3 weeks ago, we highly recommended send out a stuff on the website and the local media that we recommended people wear masks. And a lot of folks jumped on it. Of course, we had some opposition and some folks that think we're just silly, but we tried that route and I think it worked a little bit. But what I've noticed is that a lot of people want to be able to say, well, we didn't mandate the mask, the government did, or the health district did, and that takes that pressure off of them. So they can blame us for having to, and they want that. They don't want to be able to have to say it's our store policy. I mean, they could have been doing this all along if they want to, but I've had people text me and email me saying, I want to know who those businesses are because I'm going to stop, doing business there. Well, I don't reveal that information, but that's kind of the mindset of, and the other issue is we have so many people up here right now that are out in the woods camping everywhere just to get away from the crowds and the people and stuff. And of course, they still need to come in and get, whatever supplies they need at our grocery store or our liquor store or, whatever. And then they're gone again. And people, I think most of the folks that come up here are doing a great job of kind of isolating themselves, either camping or staying in their weekend home. And we appreciate that. But to me, I want to get ahead of this. I don't want to wait till we have a huge blow up of a lot of cases and then say, okay, now let's do it, because it's too late then. It just makes sense. To me, it's common sense.
Madam Chair, this is Diana.
Yes, Diana.
So, just in terms of our business owners here, while there are the outliers who are very opposed, that's been our experience. But it was really difficult for them when they were having to make it on an individual store by store basis. But being able to post up on their window and say, by local order, you have to wear a face covering. They can point at me. Yep. And they certainly have, but it's been helpful for them because allows them to focus on their core business to the best that they can. The other thing, I just, I am very mindful of all of our folks from Ada County and Canyon County coming up to McCall, and the fact that you have a 16-bed hospital. But more and more for me, it really goes the other way too, knowing that, and I was just texting with Chris Ross from St. Luke's. They're transferring every single COVID patient from Valley and Elmore counties to Ada County. They don't have the ability to serve them in your county. So your ability to have people do the right things in your county will ultimately help preserve our capacity in Ada County, both for COVID, but for anything else. You know, somebody might need to be life flighted to Ada County for who knows what. So I think it really does go both ways.
Well, and I think really what I've noticed and what I'm starting to pick up from a lot of different data and different folks is the fact that we really are not up to snuff on our medical system, especially in Idaho. We need more medical facilities, and I think that's pretty evident. And I hope the higher ups and all of our hospital systems recognize that and maybe do some long-term planning for some of the smaller counties, just for situations like this. It was really great. I had our hospital CEO there with the meeting with us on Sunday, and he said, if I lose a doctor and I lose a PA, or if I lose my radiologist, I have to shut the hospital down because nobody else can do that job. And you're only talking 3 or 4 people, and that's it. We're closed down. And people now are starting to say, now they're starting to get it. Now they understand that, if you break your arm, you might have to go to McCall, or you might have to drive clear to Boise if there's no place to go up here. And that's what we're trying to protect. And really, fortunately, so far, we don't have anything in our jail yet. We're really proud of that fact that our inmates and our jail staff are doing a phenomenal job keeping it out of our jail. So far, so good.
This is Betty Ann. I did have a question here. And once again, I mentioned this previously in another meeting about the children under the age of 2 not required to wear masks. And keeping a 2-year-old with a mask on all the time is, maybe idealist according to the CDC, but is not consistent with the American Academy of Pediatrics recommendations. So just wanted to know your feeling on that.
Well, I'm really excited about the statement that Ted said about, out of 97,000, about 2% were hospitalized. That tells me that these little kids are pretty tough and they can get through a lot of stuff on their own or at home. And you're right, you're not even going to get it. I have a 4-year-old grandson that if you put a mask on him, he plays with it. I mean, he's pulling on it and turning it around, wearing it backwards, and it's just not going to happen. And of course, our big concern right now is when the schools open about 2 weeks after that, I think then it's going to get kind of tough for all of us, but we'll take that when it comes.
Okay, so I'm still not clear about how you feel about those 2-year-olds mandated to wear masks, because there are penalties involved in this if they don't.
Well,
so Madam Chair, just for clarification, we're kind of referencing the same thing, right? It's face covering in a public space, but we never did approve the mandate for daycares. So if we think about, my kids aren't that far out of being 2-year-olds. Going to the store for 20 minutes is different than spending 8 hours in a childcare setting. So I guess I just want to make sure we're talking about the same thing.
Okay, I'm just looking here under section on number 3 under B, where it would constitute a misdemeanor punishable by fine, imprisonment, or both, according to Idaho Code 39-419, if you can't keep a mask on this 2-year-old.
Well, the way I look at that, because I've talked to our sheriff a lot about that, and there's a lot of things like that on the books, especially in boating and waterways and on the roads, that if you get pulled over for speeding or something, or for a broken tail light, and you get lippy with that officer, there's probably going to be some other things that you're going to be charged with as well. So it really depends on that relationship at the time of that traffic stop or that violation. A lot of folks aren't intentionally going to take their 2-year-old out so he can, or 4-year-old out even, infect who's ever in that store. And the store now can say, I'm sorry, but you're going to have to take your 2-year-old out if you can't get a mask on. The thing that we've got to show and prove to these kids that it's okay to wear a mask. It's okay to see mom and dad wearing a mask in the store, so I better wear a mask too. We have to set that example, and if we don't set that example, the kids aren't going to wear the mask either. I hope that helps, Betty.
Madam Chairwoman,
Yes, Megan, go ahead.
if you didn't have a follow-up, I had another question for Commissioner Hasbrook.
Okay, I was just going to comment, that this does apply to public, private, or charter schools. So daycare centers, I don't know if they weighed in up in your area, Elt, or not.
Honestly, most of the daycares are doing a phenomenal job. They tempt the kids every morning when they come in. A lot of folks aren't allowed in their secure facility. If they want to come and get their kid, they have to wait outside, and the child is brought to them. And they're really doing a great job of setting protocols to where they can't bring that in. You can't be 100% perfect. None of us are, but they realize that they've got to do a very vigilant job of staying on top of all of this. And I'm pretty proud of them because they jumped right on the bandwagon and said, yeah, we've got to do a better job of in the daycare system. We're all trying hard up here, and we're all trying to make it work. And there was a concern about you're not going to shut all the restaurants down again. No, we're not going to do that. But if we have a hot spot that keeps coming out of one restaurant over and over and over, then we're certainly going to go talk to them, and I hope the health district will back us up on that.
Okay, thank you, Elt. Megan, did you have a comment?
Yeah, I had a question based upon one of Elt's earlier comments. So did you get an indication that the Valley County Sheriff would or would not enforce a mandate if it was issued?
Right now, no, they would not enforce it. Believe me, if you know anything about your sheriff's department, those guys have way more things bigger on their plate than going around writing misdemeanor tickets for people not wearing masks. And so, but what this does is it gives that public place, that business owner or whatever facility it is, the right to say, you cannot come in here without a mask due to this order. And it's not our order, it's coming from the health district, and they can lay the blame on us. And I can take that blame day in and day out because it's the right thing to do.
Madam Chair, this is Ted Epperle.
Yes, Ted, go ahead.
Yeah, I'd like to speak in favor, in support of Commissioner Hasbrook in regards to, I think he's done an incredibly good job with talking with business owners, twice to all the commissioners of Valley County. They're certainly in support of this. By doing this now, as Commissioner Hasbrook has pointed out, it'll take the pressure off of the businesses to try to police this internally. It'll take the pressure off of the hospital for potentially getting overrun and having their beds filled to the point that then coronary artery disease, strokes, all the other things that will happen with people in the valley that need to be in the hospital will be referred. It'll also take, I think, the pressure off the schools in regards to decreasing community burden of COVID-19. So for all those reasons, I think it's a very considerably well thought out position, and I'd make a motion to approve face masking as a mandatory requirement in Valley County.
Madam Chair, I'll second that.
Okay, the motion has been made and seconded. Is there any further discussion? Hearing none, I will call for a vote by county. Boise County?
Can you come back to me real quick?
I'm sorry, Ryan, I didn't get that.
Can you come back to me?
Oh, yes, yes. Okay, Valley County,
Valley County Commissioner, aye.
Ada County,
Jamie, aye.
Ted Epperly, aye.
Commissioner Laciando, aye.
Elmore County,
Representative Blanksma, no.
and back to Boise County.
Commissioner Sturm, no. And I would like to explain that no.
Go ahead, Ryan.
So I totally understand where you're coming from, Elt, and I applaud you for trying to get the right thing done and do what needs to be done. I just kind of feel like folks in general are having a real hard time with going to the mountain communities and hoping to get a relaxing break and that when whatnot. And I know that that's kind of part of the reason that you're doing this. And I know your hospital situation because, you know, Lord knows Boise County does not have a hospital at all. And so everything that happens with us goes straight to Ada County. And actually being a person that I'm waiting on a COVID test right now because I had a patient cough on me on Friday who tested positive before surgery. And I'm not feeling too hot. Or rather I'm feeling more hot than I should. You know, I'm seeing the importance of what you're doing, and I do agree with Megan to a point where I think that we should be trying in especially in some of the outer lying counties our best to advise those. I have the same, you know, concern with my sheriff has said the same thing, that he will absolutely under no circumstances enforce a mask mandate in any way, shape, or form. And I think most law enforcement leaders have stated that to all of us at one point or another. And it's a hard thing to enforce. And you're right, it does give them an additional tool. I think your numbers are looking fairly safe right now, and I know that you are climbing, and I would definitely be in support if the numbers got worse, 100%. Right now, I think that you're right on that line, and I'm thinking that there's still an opportunity for you guys to maybe change it a little bit. And I'm with you too with the businesses. You know, unfortunately here in Boise County, the businesses don't even want to blame it on the government. They don't, you know, they aren't having it in any way, shape, or form. Most of them, the ones that I've talked to, because they fear that mask mandate will lead to a closure, right? Because we don't have takeout restaurants in Boise County. You don't get delivered food. You don't have Grubhub or any of that stuff. But kind of going on a little bit of a tangent here, but I do appreciate what you're doing, and I know, you know, I've supported it for Ada County, and I think that that's a real hot spot and a real issue. But I think that there's an opportunity for us outer lying counties. I haven't seen a whole lot of numbers from Elmore County. Thankfully, Boise County is still in the green according to the president's memo, the White House memo that came out. We're still in the green, and I hope to stay that way. And I would be curious to see how your numbers go, you know, going forward. So thank you. That's all.
Thank you, Ryan. Okay, the motion does pass, and so we will move on to our next agenda item, which is number 4, Ada County amended public health orders. This is a discussion and potential vote regarding actions to protect life, health, and safety within the district as to the COVID-19 pandemic, to include amendments to current public health orders for Ada County to restrict the size of social gatherings to either no more than 10 or to no more than 25 people. Russ, would you like to lead the discussion on this, please?
Sure, Madam Chair. So just to remind everyone, last Tuesday's board meeting, it was requested that we draft orders for the board's consideration today, and the orders would include restricting the size of gatherings and also contemplating the closure of gyms. And that was a very specific recommendation that came out in the White House report. In fact, the most recent report from the White House published a few days ago has reiterated reducing the size of gatherings as well as the closure of gyms. And they also included closing or limiting dine-in restaurants. So essentially what we did here at Central District Health after the board provided that direction is we reviewed the data. Kimberly Link, who was on earlier, it's her team doing the disease investigations. And again, there's cases all over the community, and what we're trying to find is trends where the problem areas are, as I would describe them as. Gyms were determined to not be a problem area at this time. And again, I want to emphasize it's high risk. It's a high risk environment because of the activity that takes place there with increasing breathing that produces more water droplets. Water droplets contain the virus. So it's not without risk. Again, we just did not see the cases at this time. We know gyms and lots of other businesses are doing the best they can as far as distancing and face coverings where it's reasonable to do so. So point being, gyms were removed. That's the reason. Gatherings, on the other hand, especially social gatherings, weddings, barbecues, things like that, birthday parties that involve larger groups are a problem area. That's where we're seeing a lot of our cases. And it's not just family members, it's individuals that go and participate in these activities. They get infected, then they take it back to their family. And of course it spreads there because when we live in a household with our immediate family, we don't take the same precautions as we do out in the broader community. So with this order, Mike Kane and I worked on language specific to social gatherings. So the idea is to leave gatherings at 50 or more, both public and private, are prohibited. And then we've narrowed that in for social gatherings, defined as private gatherings of people for the common purpose of relaxation or social interaction. And further, we go on to say people no more than 10 or 25, and that's up to the board to decide if you do approve this, which of those two restrictions you go with. In a single room or in an outdoor space at the same time where physical distancing of more than 6 feet cannot be maintained. Social gatherings do not include persons patronizing theaters, restaurants, retail establishments, or similar private businesses where social distancing is practiced, or attending places of worship for the purpose of exercising religious activities. And again, when we were thinking about a restaurant establishment, that's when you would have, maybe I would be there with my family and Dr. Epperly would be there with his family, but we're not there together. We're sitting at separate tables. So obviously in that case, there would be more than 25 individuals there, and that is not the intent of this order. The only other point that was made was under the exceptions for wearing face coverings, and this was one of the comments that came in, I think last week, was related to, it's not just students who are out participating in sports and athletics. So we just moved that, remove students and include just persons in place of that. So that's all I have, unless you have any questions.
Madam Chairwoman, this is Representative Blanksma. Believe it or not, I have some questions.
Go ahead. Yes.
Okay, thanks, Russ. I got a couple. So if you have a social gathering and you make the assumption that more than 10 are prohibited, if I have a kid's birthday party at a movie theater for 20, that is okay. But if I have a kid's barbecue for 20 at my house, that is not. Is that correct?
Madam Chair?
Yes, go ahead, Russ.
That would not be correct. It wouldn't matter where you have that social gathering. The point of the exception for a restaurant, or in your example, a theater, is people are there for the purpose of relaxation. They're not there together. So if you were to take 20 kids to a birthday party, to a restaurant, or to a theater, then we would interpret that as violating the orders as they're drafted.
Madam Chairwoman.
Yes, Megan, go ahead.
Another question. So I would double check your language, because I wouldn't agree. And if you want it reviewed by the AG, we can certainly do that. But I think what your language says is that if we're at a retail establishment at a kiddie party, be it a movie theater or Wahoo's or a water park, then your order here doesn't necessarily, it exempts people patronizing those areas. It doesn't necessarily define it. It's not well defined, is what I'm saying. I think if that is your intention, then we might want to revisit that, if that's the intention. The other question we kind of glossed over, on page 1 of the order, there's been a change in on number 3 in findings, and it no longer says Ada County is reporting a significant increase in hospital admissions, but it says a significant number of hospital admissions. And I wonder, two questions under this. One, is that number determined according to the criteria you gave us? And then if you go down, there's also a change in an edit where it said initially all patients if the upward trend continues at the current rate. And it's now been changed to if there is an increase in the number of patients admitted with COVID, without a delineation of between whether they're admitted for COVID-related illness or if they just have COVID and are admitted for, say, knee surgery. So I just wondered why those two changes were made.
Sure, Madam Chair.
Yes, go ahead, Russ.
So those are both great questions. As far as the increase, we're not seeing an increase, as Kim Link explained earlier. What we're also not seeing is we're not seeing a decrease. So the number of patients who are currently being admitted to the hospital remain concerning to the health systems. So that's to that point. So again, it was just changing order to reflect what we're actually seeing today or over this past week or two, versus when the orders were originally implemented, there were far fewer cases in the community, and those were steadily rising at the time back in June. So do you have any questions about that response for that question?
No, thank you.
Okay. So for the second one, it's similar. We were seeing a pretty steady upward trend that has leveled off, and I think right now, it's always too early to tell because we don't have a long period of time, but we have seen a slight decline in the number of patients admitted with COVID-19 at our hospitals. And as far as the other question, for or with, I actually just had a conversation before the board meeting today with St. Luke's, is if they're there for COVID, it's definitely a strain on the system. That's why they're there. Those are added patients, not just the person who tested positive with COVID, but they're there. A really good example would be a lady who's there to deliver a baby. If she tests positive for COVID, that is a strain on the system because of the added staffing and added PPE resources to make sure that other patients in the hospital aren't infected. Of course, the staff there as well. So it's not, we're not changing the target. It's clarifying what we're currently seeing today in the experience of the hospitals that they're sharing with us.
Okay, thank you, Madam Chairman. Just one more thing just to clarify.
Yes.
So if I understand you correctly, the orders have been modified because they'd conflict with the new set of standards that was just presented, because the number is static in one and a slight decline in the other. So this is to take account for that.
I'm sorry, Madam Chair.
Yes, go ahead, Russ.
I would say it wasn't so much as far as any changes in the criteria. We did change the criteria from ED visits with COVID-like illness to hospital admissions, just because of the circumstances by which patients are now getting admitted to the hospital. This is just really reflecting, I took out increase, for example, increase in hospital admissions, because we're not currently seeing an increase. We're seeing leveling, which is again very encouraging. The problem we have is we're still seeing well over 100 plus cases per day and still having 200 case days, and that's the concern we have right now.
Any further comments?
Madam Chair,
Go ahead,
Yes,
Jane.
Jane, go ahead.
I just had a really quick question. Am I making that? Huh. I was wondering if anybody had found any scientific data that talked about the difference between 10 and 25 for outcomes. I mean, aside from common sense, I could not find anything that spoke directly to that.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
That's a really great question, Dr. Young. There isn't really good data on that. Obviously, if you're around more people, as you know, there's more likely that transmission to occur. So by limiting the size of gatherings from large sporting venues down to gatherings of 50 or fewer, down to 25 or 10, it really is a judgment call. Right now, we are seeing a lot of the cases, like I mentioned, with the social gathering events. And if you have a gathering of 25, obviously you're more likely to have people outside your immediate family and maybe even extended family. Whereas if it's a social gathering size of 10 or fewer, that's going to be more limited to your immediate family, probably individuals you're already interacting with anyway. So I can't say, 10's perfect or 15's perfect or 25's perfect. It's our goal here is to take what we're seeing today, which is we've leveled off. The cases have been pretty level, but we are not seeing the decline in cases that we would like to see. And, I think about back to the conversation we had last week around schools, might have been the week before, and the challenges with them operating in a category 3 versus even a category 2. So I'm sorry, that was a kind of a long response, but it's not just crystal clear at this number. It's good. It's this number more dangerous.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So I've been looking, and I don't know how well it's been vetted, or whether this tool played into the White House's recommendation. But again, this was coming from the White House Coronavirus Task Force. Dr. Birx called Ada County Commissioners about this 2 weeks ago. I've been looking at the Georgia Tech Event Risk Assessment Planning tool, and I just dropped it in our WebEx, and I guess, Russ, you can put it on YouTube. But, it takes a look at your rate of prevalence, your cases per 100,000. I think it also takes a look at the positivity rate, and then you can select your area, and you can drop in an event size, and it can show you what the likelihood or probability of transmission is based on that. Again, we're all kind of, we're building the plane as we fly it on all of this stuff because it's happening so fast. So I don't know how much this has been vetted. But I know a lot of folks are taking a look at what Georgia Tech has put together.
Madam Chair, this is El.
Yes, Al, go ahead.
What I'm wondering is, is if we went to, let's just for example, if we went to 25, Russ, would we be able to correlate the response to 25 versus 10? I mean, can we follow that data to see, yeah, this actually did drop cases, or is it going to be twice as fast at 10 and only half as fast at 25? And, you know, I mean, that's kind of a hard question to answer. I realize that, but to me, it's pretty subjective.
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yeah, Commissioner Hasbrook, I think you're exactly right. It is subjective, and there's so many factors, you know, going on in the community that will influence our cases. Namely, like in Valley County, the schools going back into session, and even here in Ada County, things are going to be changing with utilization of childcare and group tutoring and things going on with schools. So I really think it would be impossible to really differentiate. You know, if you do 25, we would have been able to be, you know, this much further along, or if you choose to do 10, you know, it'll drive the cases down this much quicker. I think it really comes down to, you know, that's an area where we're seeing a lot of cases coming out of that then go to immediate families and then spread within that household family unit. You know, like I said, the way I think about it is if you have a group of 25, most likely you've definitely, in most instances, gone beyond your immediate family, and you're starting to invite friends and others who you might not typically interact with in that type of setting. Whereas 10, it's far more likely that those will be your very close family members.
Madam Chair.
Chairman, Mike.
Mike, go ahead.
I thought it might be useful to tell you how we got to this definition. If you remember the original direction from the board, it was just to say gatherings of all kind. It didn't say anything about social gatherings. And when we began to look at the cases throughout the country, we began to realize that just to say gatherings, it would eliminate all sorts of things, city council meetings, corporate board meetings, even legislative committee meetings. And that's not what you were looking for as we understood it. What we understood the driving force for this was the cases coming out of parties and celebrations. And what I did was I went out into the cases out throughout the country and tried to use other states' orders to try to define more carefully what a social gathering was, and that's how we got to the language that you're looking at. Most of the cases on gatherings are either 50 or 10. There doesn't seem to be any real rhyme or reason as to why that number is appropriate, but of course the president has sent out the guidance of 10. It's an exercise in line drawing, and if you determine 25 is more appropriate, that is going to be your call. The other thing I wanted to point out is as to the social gatherings, as long as physical distancing of 6 feet is maintained, it's not going to be a problem what your number is up to 49. So there's that. We also added what social gatherings are not, and as Representative Blanksman correctly pointed out, it's not patronizing theaters, but you have to go to the last part where social distancing is practiced. So what we were trying to capture here was what we were understanding was driving the increase in cases, which was essentially private gatherings for the purpose of social interaction. That's where the cases are coming from. But we didn't want to limit it where there still is physical distancing. And we didn't want to include patronizing private businesses as social interaction.
There was someone else that spoke up at approximately the same time Mike did. Who was that?
Yeah, that was me, Madam Chair, Ted Epperle here.
Yes,
So
go ahead.
a couple thoughts. And I want to come back to the social gatherings, but I want to make a quick comment on the gyms. I think every single one of us recognize the importance of exercise. And boy, I'll tell you, we got a lot of emails about gyms. So thanks to all of you out there that care a lot about this topic. And we all recognize the importance of exercise, not only physically, but mentally, socially, emotionally, in so many ways. So I just wanted to make a comment back to the public about gyms. And that is, please, to you all, do your parts. Step up to the plate, make sure you mask, make sure you socially distance, make sure you hand wash, make sure that you contact clean surfaces afterwards. And please don't go there if you're feeling ill that day. By doing this collectively, we can keep the gyms open. The problem comes if we don't do that, then there will be a cluster of cases that'll come out of a gym, and then we're going to be forced to act on this. The White House has already called us out twice for closing of gyms. We're actually not going to do that, but now comes the part of the public to step up to the plate on this. I think that is the appropriate decision. So please come through in regards to that on your parts for accountability and responsibility. That said, back to the issue of social gatherings. In listening carefully to the discussion, I think that, again, the intent and the goal here is we want to try to limit spread of the disease in our community that is way greater than 100 cases per day. We're at a positivity rate that puts us in the red zone for schools. And so if we do take a proactive step, what it's going to translate into at this point is we're going to really help take some of the pressure off of businesses, just like Commissioner Hasbrook is dealing with in Valley County. It's going to take some of the pressure off of schools just by decreasing the background disease rate. So I think in thinking through this, I am in favor of limiting the social gatherings to less than 10. I think that the language is really clear on if social distancing is being done, then you can have groups greater than 10 as long as social distancing is done at those groups. But if they're not being done at that group, then I think 10 is the right call. And the reason, and I'll stop with this, is just exactly what Mr. Duke had to say. And that is when you get above that number, all of a sudden you have a lot of different community people in the group versus a social gathering that's family only. So 10, I think, carries probably a lot more reason than 25 in this particular case. But to the community, if social distancing is done at greater than 6 feet, then you can certainly have that social gathering with groups larger than 10. And that's the distinction. So I'll stop with that. Thank you.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
I want to follow on Dr. Epperle's comments. We did receive a boatload, a plethora, you name it, number of comments. But I just want to reemphasize, it's not the number of those comments that has certainly changed my mind or helped me along in this. As I looked through and talked with Russ and Kim about the case data, we're just not seeing cases come out of gyms as clusters. And that's fantastic. And it means that people are hopefully taking the precautions at gyms, both the business owners and the patrons. But as Dr. Epperle noted, is going to require continued vigilance, probably especially toward the masking component, to make sure that continues to be the case so that people can enjoy being able to go to their gym, being able to work out and really handle that. And I'll just note that if we do see major clusters coming out of those settings, then we will have to be prepared to do something. On the social piece, I guess I would just say from firsthand knowledge. It is so hard when you start getting people in a less controlled environment to socially distance. And it's, you know, who is policing that? Who is ensuring that people are wearing masks? You've got this social pressure piece. It's very difficult. And I guess I would note that it, you know, it's not as if, as we've done all along, it's not as if our sheriff's deputies or police officers are going to be, you know, driving around and checking in on backyard barbecues. That's obviously not going to happen. But I think it sends a message to the community that this is a high risk environment. And, you know, I'm feeling this very acutely. I'm planning a funeral right now, and we are having a service, and then we are not having any kind of reception, because the, you know, the worst thing that could happen would be for us to inadvertently hurt both some members of family and friends, but also then put that further strain on our healthcare system. So I'm ready to support Dr. Epperly's thought there. I, like many people, I'm feeling pretty fatigued of all of this, and I guess I want to know I'm ready to support it, but you know, we don't control what happens right next door, and I'm continuing to feel very frustrated that Ada County is bearing the brunt of this to preserve healthcare capacity when we know that patients are being transferred from Canyon County to Ada County every single day. And I'll just leave it at that.
Any further comments? Hearing none, is there a motion or to vote on this issue?
Madam Chairwoman, Madam Chairwoman, this is Ted
Yes.
Epperly.
Yes, Ted.
Before we make a motion, I'd like to ask probably our best public health expert that we have on this Zoom call, and that's you, Russ. I know that you've considered all the information, you've heard the discussion from us as board members. What are your thoughts on this before we articulate this in the form of a motion or not?
Madam Chair.
Yes, Russ, go ahead.
My thoughts are that we have been successful in leveling off number of cases. We've been successful at leveling off the impact to our health systems. We have not been successful yet in any material way as far as driving down the cases, both in the community and the impact on our health systems. This is where we're seeing our current, most cases are coming out of both social gatherings, family to family transmission, and in workplaces. If we want to see the cases decline or decline at a faster rate, and I think it's a critical time to do that with our schools. Many of them have already made decisions to delay opening or virtual to start. I think this would be a good step. Is it absolutely necessary to protect our health systems from getting overwhelmed? No. Is it absolutely necessary to protect the vulnerable population? No. But it's just a matter of where we're at today with 100+ cases per day, and we take no action. It would be more of a wait and see. But there's not a lot of time to do that, for example, for the schools and their plans to open after Labor Day or try to open even in a hybrid model. So it's really a policy decision. I think if you decide to move forward, I think it'll have a positive impact on driving the cases down to a more acceptable level, possibly, over time we'll be able to relax the orders. That's the goal.
Madam Chair, this is Ted Epperly then in follow-up.
Yes, Ted.
Thank you, Betty Ann. Thank you, Russ, for your thoughts and feedback. And I agree in the sense of we're at a critical moment here. And I think part of the challenge we're all facing is we don't want to actively limit people's abilities in this environment to get together and to enjoy each other. That's what's so painful about this, is none of us are in favor of mandates. None of us want to proactively overreach or over-control people and their behaviors. None of us want this environment, but it is what it is. My concern at this point, if we don't do this, we're well north of 100 cases a day, almost many days, as has been noted, over 200 cases a day. We've got schools opening. If we decrease the COVID-19 burden in our community, all of us will get back to a more normal life faster than by continuing to kick the can down the road. So I'm prepared, Betty Ann, to make a motion to the board that we do restrict social gatherings to less than 10 people unless social distancing is occurring, all in the spirit of let's do what we can do to start to limit the COVID-19 burden in our community so we can all get back to a more normal life.
The motion has been made. Is there a second?
I will second that. This is Diana Laciando.
The motion has been made and seconded. Is there any further discussion before we call for a vote?
Madam Chair, this is Commissioner Hasbrook.
Yes, go ahead.
I would like to ask Ted to amend his motion. This is just for Ada County.
Yes, Madam Chair, yes. This is Ted Epperly. Yes, I'm sorry. I should have made that clear, Elt. My motion is intended only to be to Ada County because that is where the disease burden is right now. It is not that high in the other counties. This is strictly only to Ada County.
Thank you.
Madam Chairwoman?
Yes, Megan, go ahead.
I just want to make a clarification so I fully understand. So what the motion is to take the draft, including the changes on page 1, not simply the social gatherings, but including the changes on page 1 that change from the increased number of hospital admissions to just the number, and then eliminate the upward trend as well on that language, so that the draft is actually the new red line language. I want absolute clarity on what we're voting on here.
Madam Chair, if I can just clarify with Mr. Duke on that added language, because I was specifically talking about social gatherings, but to Representative Blanksmith's point, maybe we can take care of it all at the same time. Russ, my understanding of the red line language in the draft that's been provided to the public is that's just some clarification of the existing, how we're applying the data that Kim Link has gone over in a way to then have congruity between what she described and what the data points we're looking at. Is that correct, Russ?
Madam Chair?
Yes, Russ, go ahead.
Correct, Dr. Epperly. It was just looking at the order and making the modifications. Like I said, there was the modifications early on in the document. That's the draft that's published for the public view starting last Friday. And then also there's the additional change under section 4B letter G, where we modified from students actively engaged in athletic competition to taking students out and then adding persons, because of the fact that I mentioned earlier, it's not just students actively engaged. And then there's also one additional change that, again, I would recommend the order, if you're going to adopt the orders with social gatherings of more than 10 are prohibited, with the exceptions of physical distancing, I would recommend you adopt the orders as drafted. And the one other reference was under section 8. It referenced the Idaho Department of Health and Welfare code, and at Mike Kane's advice, we made a change to that so that it references our local public health district law under Chapter 4 of Title 39.
And Betty Ann, this is Ted Epperle again. I would just, for clarification reasons, have the red line changes that have been produced to the public all accepted in this particular motion, because there's nothing of substantive content change there. It's only a clarification, so there's a clear alignment on what the metrics and the dashboard will be that we're looking at, not only to go into these, but when to exit out of these recommendations we're making. So I would, to Megan's point, I would make it for all the red line changes that we have in front of us now.
Okay, Ted, this is Betty Ann. After all this discussion, especially for the public's information and clarification, would you go ahead and restate your motion with the said amendments, please?
Okay, Betty Ann, thank you. I would make the proposed recommendation that we accept the red line changes produced in the document that Mr. Duke has provided to us and to the public. Those red line changes have been published since Friday, that we make all those changes, and in particular in regards to social gatherings, that we adopt the language of having that be for less than 10 people.
This is Diana Laciando. I will second.
Okay, thank you. And once again, that clarification, you didn't state it, but does include Ada County, correct?
Yes, I'm sorry. Ada County, yes.
Okay.
Madam Chair, this is Russ.
All right, I will. Yes, Russ.
Just a very, very quick clarification. So Dr. Epperle said of less than 10, and our orders say social gatherings of more than 10. So it's just as would be 9 or fewer, and the orders as drafted are more than 10 are prohibited. I just wanted to make sure that was clear.
Thank you. The way the language is.
Okay, I'll go ahead and call for a vote from the counties. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperle, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Blanksma, no.
Okay, thank you. The motion does pass as stated. And we are now to the end of our agenda for today. The final item for our meeting is I will call for a motion to adjourn.
Madam Chair, this is Commissioner Hasbrook. I'll make that motion.
Okay, thank you. Elt, do I have a second?
Madam Chair, this is Jane Young, aye. Second it.
Thank you, Jane. Okay, calling a roll call vote if there is no further discussion. Starting with Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperle, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you. Okay, our next meeting for the public's information will not be a week from today. It will actually be on the 21st, which is our regularly scheduled meeting. that does start at 8:30 in the morning, and it is a long, quite a bit more lengthy meeting that we will have at that time. So thank you, everybody, for your participation, and have a good week. Goodbye.
Commissioner Sturm, I hope you feel better.